first? Yes, please. Yeah. Thank you.
Okay, so we're ready to go?
One moment.
Okay. Okay, so we're just admitting everybody and we'll be ready to go in just one moment. Okay, I just am looking, it looks like everybody is admitted and welcome. I'm just gonna make sure we're good to go and then I'll get started. Are we good to go?
We are.
Okay, thank you. My name is Natalie Mehra. I'm the Executive Director of the Ontario Health Coalition. Welcome to this press conference, which is about discrimination against the elderly and a call on the Human Rights Commissioner in Ontario to use her powers under the Act to hold an inquiry into age discrimination against the elderly in healthcare. This has been made all the more pressing because of the Ford government's new Bill 7, euphemistically called the More Beds, Better Care Act, which does neither. What it does is it enables the government to suspend the right to consent for elderly patients who are waiting in alternate level of care beds in hospitals for long-term care. It allows them to assess those patients without their consent, to share their personal health information with an array of long-term care homes without their consent. It enables them to fill in the application paperwork without their consent and admit them into a long-term care home without their consent. It is a terribly egregious piece of legislation. It targets one class of patients, the frail elderly mostly, and people with disabilities who are waiting for access to long-term care beds. And we feel that it is discriminatory and that the Human Rights Commissioner should weigh in. A year ago, in March 2021, the Advocacy Centre for the Elderly, CUPE, and the Ontario Health Coalition joined together to call on the Human Rights Commissioner in Ontario to hold an inquiry as a result of the egregious discrimination and ageism that we saw in the pandemic response. And this included several rounds of offloading hospital patients into long-term care homes, even into long-term care homes in outbreak of COVID-19, overriding patients' consent in an array of those cases under temporary emergency orders and other types of directives in order to clear out hospital beds for COVID patients. But it wasn't just because of COVID. It was because Ontario has pursued the most aggressive policy of hospital downsizing in the country and in the developed world. We now have the fewest hospital beds left of any province in Canada. We are far below our peer countries, some of which have double almost the number of hospital beds per person that we have. We fund our hospitals at the lowest rate. And at each stage, the pressure on the elderly, the treatment of the elderly as if their right to care is somehow lesser, as if their claim on a hospital bed is somehow, or on resources in the health system is somehow lesser than others. It's discriminatory. Now we have this new act which would, in law, enshrined in a permanent law in Ontario, suspend the rights of this target population and deprive them of the right to consent at the very last stage of their life. I just want to end by saying this. You know, there's no way that the politicians in Ontario missed it. There's no way that Doug Ford, our premier, there's no way that Paul Calandra, the Minister of Long-Term Care, missed the suffering and the harm that was caused when people were moved away from their families, when they were isolated from their families in long-term care homes during the pandemic. It is seared on the memory of the families. It caused a kind of suffering that we have never seen before. And it resulted in the decline, the permanent decline, and the death of thousands of people. Now, you know, we have this law which which codifies that very practice after everything we've seen in the pandemic. They have not improved long-term care for people. They're sending people to the worst homes that they don't want to go to, far away from their families, isolated from their communities and their loved ones. It's like we've learned nothing. Nothing has improved. And in fact, this is an egregious step in the wrong direction. So we're hoping that the Human Rights Commissioner, who did not hold an inquiry before, will finally weigh in on this and take action against this kind of discrimination. Okay, thank you very much. I'm not sure who I'm supposed to turn it over to. Is it Graham? Graham?
It is.
Graham Webb. He's a lawyer and executive director at the Advocacy Centre for the Elderly. Thanks, Graham.
Thank you, Natalie. As Natalie said, I am Graham Webb. I'm a lawyer, the executive director of the Advocacy Centre for the Elderly, a legal clinic serving low-income seniors in the city of Toronto and elsewhere in Ontario. I have been a lawyer at ACE since May 1995. I've been doing this work for more than 27 years, and I've been seeing these issues through the entire 27 years I've worked here. Bill 7 is part of a pattern of elder abuse and discrimination engineered by the province of Ontario in 4 steps. The first step is that there are not enough community-based alternatives to long-term care. Going into long-term care should always be a free and voluntary choice. People should go into long-term care because they want long-term care. There are many, many older adults residing in the community who require in-home and community-based services they simply can't get. And because of this, they are forced into long-term care. They really have no alternative. This is abusive and discriminatory. If you were a younger person with a disability, perhaps a developmental disability, you would no longer be forced into an Ontario hospital for want of any other form of care. You might have access to a group home or community-based programs and services that would meet your needs without going into such a facility. If you are older and you have disabilities, there simply are not the services that are needed in the community and in your home to meet your needs. We at the Advocacy Centre for the Elderly are hearing the voices of many, many, many Ontarians who are crying out for new initiatives to provide better and more in-home and community-based services. We all need to listen to these voices, and we need to provide alternatives so that admission to long-term care is always a free and voluntary choice, not one made under coercion for lack of any other alternative. The second step of this pattern of elder abuse and discrimination is that there are not nearly enough long-term care beds that people want. There are empty long-term care beds. They're empty for a reason. The reason is people don't want those beds. They're living at home. They could choose to go into the vacant bed or not. And given the choice, they're saying, I don't want that bed. And in retrospect, looking at the effects of COVID-19, you must admire the wisdom of many of those people who did not want those beds. We saw that when the long-term care home system was placed under stress, the stress revealed that many of those homes were unsafe, that they were not good places to live, that in some cases they were places to go and die. When we see community dwelling older adults have available vacant beds in their communities, it's not necessarily about where the beds are, although it may be. It's about what the beds are. When we see older adults refuse those beds and say, I would not choose to go there, I think the government of Ontario and the people of Ontario should respect those choices and not be forcing people to go into beds they don't want. If you're living in the community and you want admission to long-term care, you might have to wait a very long time, not weeks, certainly months, and possibly years, to obtain a bed of your choice. We need more long-term care beds, as well as more alternatives to long-term care. The third step of this pattern of elder abuse and discrimination is that hospitalization of the elderly has become a standard step for admission to long-term care. An older adult applying for long-term care from the community is applying because they need help that they're not getting at home. They may have an advancing health condition. The waiting list for long-term care is so long that it may become a race as to whether you have to go to hospital first before your long-term care bed is available, or whether perhaps you even die first before your long-term care bed is available. A very high proportion of long-term care admissions are coming from hospital, to the exclusion of those who are living in a community. It is abusive and discriminatory that you cannot get into long-term care from the community. You have to get so sick that you go to hospital first and can only gain admission to long-term care from hospital. That is an instance of elder abuse and discrimination. And the fourth step is now with Bill 7, that shockingly, hospitals may apply for your long-term care admission to facilities you don't want without your consent. You're a hospital patient. You should have the right of privacy to your personal health information. Under Bill 7, a hospital discharge planner can send your personal health information far and wide to staff members of long-term care homes that you want nothing to do with, breaching your privacy rights and breaching your charter right of the right of security of the person. This is wrong. And we're told that if you are offered a bed at a home you did not apply for and was applied to on your behalf without your consent, and perhaps even with your knowledge, nobody will force you to go. They won't apprehend you, but they won't force you to go if you know your rights. So many older adults do not know their rights. They don't know that they have the right to refuse, to say, I'm just not going there. And so many older adults will be coerced into these non-consensual admissions to long-term care, and they may stay in that home for a very length of time, perhaps for the rest of their life. And in the years that I've done this work, I've found there are three categories of people who are affected by the threat of charging hundreds, if not thousands of dollars per day in uninsured hospital services. They say you can refuse the bed, but we hear from even Premier Ford that the hospitals may be able to charge you an amount that you might not be able to afford. One group of people that might not affect are older adults who are simply penniless. There are many of those older adults living on the old age security pension, the guaranteed income supplement, who have absolutely no property, no savings. They could charge those people $1 million a day and it wouldn't make any difference. The threat of charging an uninsured hospital payment, if those people know their rights, should make no difference. But many of them don't know their rights and they will go anyhow. The second group of people is people who are well enough off that they could pay the uninsured hospital rate and would choose to pay the rate rather than be forced into a bed they don't want. In the 27 years I've worked here at ACE, I can remember clearly a telephone conversation I had with an older man whose wife was in exactly this situation where she was in a hospital bed and threatened to be charged $1,500, $1,800 a day if she did not take the first available long-term care bed. That man said to me, "Mr. Webb, I've been married to my wife for 60 years. She's the love of my life. I don't care if we have to spend every penny we ever have. She's not going to that home. They can charge me what they like, but she's not going." And that man had the ability to pay the amount that would be charged, and that was his choice to do so. And there will be some people who would rather pay the uninsured rate than have them or their loved one go to a home they don't want. Then there's the vast majority of older adults, middle-income older adults who have some life savings to protect a home, property interests, who will be threatened with a charge of hundreds or thousands of dollars per day that they can't afford to risk. And those people would be coerced into going into a bed they don't want or being charged the uninsured hospital rate. This is something that most affects the vast majority of older adults in Ontario, and that the vast majority of older adults in Ontario should not accept. These four elements: no alternatives to long-term care, not enough long-term care beds, forcing admissions to hospital to get long-term care admission, and then forcing non-consensual admissions to long-term care coming out of hospital are only the beginning of the picture. In addition to that, some of the issues we raised a year ago and that still are unresolved are the lack of access to rehab for older adults, continuing complex care. There's no legal process to apply or to challenge a refusal. Those facilities are being cut back. We at the Advocacy Centre for the Elderly find that when there are cuts to the healthcare system or any other system, the people who are most vulnerable and who are first affected are older adults. There are some empty long-term care beds in Ontario. So the plan is to try to solve the problem of hospitals and long-term care on the backs of a small group of older adults who will be forced unwillingly into their homes. Can you accept that? I can't. That is unfair. It's abusive. It's discriminatory. And it's something that we in Ontario should not tolerate or accept. This bill, Bill 7, targets the elderly. In Ontario, we should never target the elderly. We should not accept this. Thank you.
Thank you, Graham. Now turning it over to Michael Hurley. Michael Hurley is the president of the Ontario Council of Hospital Unions, part of CUPE, Ontario. Go ahead, Michael.
Thank you both. Older persons have borne much of the brunt of the cutbacks in healthcare in Ontario. They have been most likely to be sent home from hospital without their care needs being addressed. They are most likely to be discharged prematurely. They are most likely to be readmitted. They perished by the thousands in long-term care during the pandemic. The causes for this are systemic. Ontario has the fewest hospital beds to population of any province in Canada. Our hospital system has been eroded by decades of real funding cuts that this government plans to extend for the next 5 years. Hospitals are in the grips of a severe hospital staffing shortage, as is long-term care. We are so deeply disappointed that the government's first major move to address the staffing crisis will have no impact on it at all. Emptying beds of ALC patients and replacing them will do nothing to retrain or recruit staff. ERs and ICUs will continue to close. The forced transfers will, however, deal with the problem many for-profit long-term care homes have had since the pandemic. No one wants to go there voluntarily, and now through forced transfer, their occupancy issues will be resolved. Bill 7 targets alternate level of care patients in hospitals. They are overwhelmingly elder Ontarians. The designation of alternate level of care is a crude brush. The New England Journal of Medicine published an article recently that found 20% of so-called ALC patients are hospital dependent, by which they mean they will be readmitted within 30 days of discharge because the care they need is beyond the resources of long-term care. In our rush to empty beds, many elderly patients who still require acute care will be forced to go to long-term care facilities. This will be done through Bill 7's new mechanisms: suspending the consent to treatment, breaching privacy rights, suspension of the right to appeal the decision, forced transfer outside of the community as far as 300 kilometers in Northern Ontario and 100 kilometers in the South. These are suspensions of basic civil liberties, and the liberties being suspended are effectively for one age group. It will also be done by effectively suspending consultation with the legislature and with the public. The bill just passed under time allocation, with no committee hearings, with 2 hours of debate, with second and third reading in the same day. The Ford government effectively prevented any meaningful input on Bill 7. Older persons have borne much of the brunt of the cutbacks. We know from previous transfers and studies that patients who are moved in this way from hospital to long-term care or even to another hospital have a higher death rate. This is what happened when patients were transferred from Perth to Smiths Falls during the Mike Harris reforms. Many of those patients died, but there are studies that speak to the higher mortality rates. We believe that this age cohort is being actively discriminated against, and that the discrimination goes to the heart of key rights that every citizen should enjoy. Therefore, today we are calling on the Ontario Human Rights Commission to conduct a systemic inquiry into discrimination on the basis of age in the provision of healthcare for this age group. This discrimination is stark, and we urge the Commission not to turn its back on the elderly in this way. And now we're going to take questions. We'd ask you, if you wouldn't mind, to use the raise hand feature, and we'll take your questions down, please. Craig, are you Liz Payne from the Citizen? Elizabeth?
Yes, hi, thank you. What difference would an inquiry make in real terms in the lives of these patients?
Graham, maybe? Do you want to take that?
Well, I think, first of all, an inquiry is a legal process that could result in a finding of discrimination, and predicated on that finding, there may be remedial action that would be directed towards the Government of Ontario. For example, to include things like provide alternatives to long-term care, to take other steps that would prevent the discrimination. It's a legal process that it's hard to determine the outcome at the beginning, but it's a worthwhile process to follow.
Can I add to that too?
Yeah.
I feel strongly that what's happening, like we hear, and I think you know this too, Liz, like from the CEOs of hospitals, right on through the clinical leadership, right through the staff, you know, everyone has been taught now that there's an endless competition for ever more scarce resources. And everyone has kind of bought into this, this ageism. But when you lay bare what just happened with Bill 7, they have decided that a certain group of people, the frail elderly who are in hospital waiting for a long-term care home of their choice, are expendable. That's what they decided, because everyone knows that if they're moved far away from their families, if they're moved against their will, their chance of decline and death are extremely high. And so they've named these people now as expendable human beings in the race for ever scarcer resources in our healthcare system. We need the healthcare leadership to wake up to how cruel and ageist that decision is. This is not normal. Ontario is an extreme. And yes, it's other options to long-term care, respectfully, yes. But also, you know, we have fewer hospital beds than anywhere else. We run our hospitals at rates of overcrowding that no one else in the world, you know, civilized countries in the world do not do. They don't have this kind of terrible cruelty to access resources for people who are aging and dying that we have. And it's a failure of health planning. So I just feel really strongly like there has to be a way to cut through the fact that this has become normalized to the point that a provincial government thinks that they can pass a law that is almost a death sentence for one particular group of people. It's hideous, and it needs to be shown for that.
Greg Easterbrook from North Bay. Greg.
Hello, Michael. Good day. Listening to this, and I mean the fact about Ontario being so low, you know, in status in regards to the number of hospital beds in a province of almost 15 million it's a generational thing. I wanted to ask what can be changed and why it hasn't been changed, and where's the outrage from? If the elderly can't advocate for themselves, their families certainly can. Where's the outrage? Is it coming?
Well, in fairness, you know, this bill was announced 10 days ago, a week ago, and it's been rammed through the legislature, I think, and it's been rammed through in the last week of August, right? It's been done under, you know, under a smokescreen, and people aren't aware, I think, to a large extent, of this bill and the powers that it gives the government and health authorities, et cetera. So I think you're going to see the outrage building, Greg, and I think you know, that's something that we're all going to be working on to try to ensure is that the outrage is given a voice and that voice is effective.
We're hearing the outrage now. We're hearing it.
And if I may add, Greg, I agree with Natalie and Michael that the outrage is here. From where I sit at the Advocacy Centre for the Elderly, we're hearing outrage from many quarters. And I think evidence of that comes in the fact that the government of Ontario has put through Bill 7 without any public consultations. They're not having committee hearings. They're not having public submissions on the committee hearings. They certainly did not consult with us, the Advocacy Centre for the Elderly. I would infer that the government is putting this bill through without public consultation because they don't want to hear the outrage that's out there. It was not an election platform. They were just elected and said nothing of forcing transfers without consent of older adults from hospital into long-term care. Why not? I don't know why, but I think that they are evading the public outrage that's out there, hoping for another period of years to pass before they have to face the public again on this issue.
Thank you.
Greg, did you get that answered?
Yeah, it's good answers. Thank you.
Salvatore?
Thank you. Can you hear me? Yes, I wanted to say that Seniors for Social Action Ontario has asked the Human Rights Commission several times to intercede and to state something. And on several occasions, it has simply said it doesn't have the resources to do it. In the last instance, with respect to Bill 7, it said, well, we're monitoring the situation. We've decided not to do anything yet. We may make a statement later. What on earth has to happen before the Human Rights Commission sees that this is a serious matter that cannot be delayed?
Salvatore, I don't have the answer to that. All we know is that we can continue to ask the Ontario Human Rights Commission to inquire into discrimination against older adults on these issues. And we can only hope that they will accede to the requests of ourselves and to the Seniors for Social Action Ontario and to others who may be asking for remedies on human rights issues like this.
Will there inevitably be action, legal action, class action, lawsuits, as people actually understand what their rights are and they're being abused, and go to the Human Rights Commission with individual complaints?
I expect there will be legal actions. I wouldn't say whether those are class actions or whether they're human rights complaints or legal actions of other types. But I do expect that there are rights and interests at stake, including charter rights coming from Bill 7 that will eventually be litigated. Litigation doesn't happen overnight. Good litigation takes thought and deliberation to develop, and it also takes a fair amount of time to resolve. So this is not a fire department, but it is something that will happen if this situation persists.
We certainly are committed to looking into whether or not there's a potential charter challenge on this legislation. And, we're obviously it's brand new. So we need some time, and we will work with partners like the Advocacy Centre for the Elderly and figure out, who wants to do what and so on. So it's very early days, but we are committed to that. This is so deeply wrong that we think we have to do everything we can.
And if I may clarify, the Advocacy Centre for the Elderly is a legal clinic under the Legal Aid Services Act. Our mandate is to provide legal advice and representation to low-income seniors who ask for our advice. Hardly a day goes by that we don't have calls about discharge from hospitals, and those calls will be including issues related to Bill 7 once Bill 7 is being implemented. And so any legal actions that we undertake at the Advocacy Centre for the Elderly would be on the instructions and on behalf of low-income seniors who have a direct interest in the matter. Those are our clients, and those are the people we would be representing, not other groups.
I don't see any more questions. So if there aren't any, then we would thank you very much for attending today. And we will be in touch soon. Thanks so much.